Hello, how are you? Um, Introduce myself. My name is Wail Rasheed. I have been work for a pharmaceutical company for the last 28 years, focusing on bringing a new branded medicine to for patient and for human. I am very much appreciate the opportunity to bring this class, to teach this class for your university. Reach out to me, and I know have a lot of good friends and a lot of people there. I know I'm very actually pleasure and honor to be able to introduce myself and also to give back to the students, and hopefully my my teaching style and my the knowledge I'm going to bring is beneficial to all the students. I never taught a nursing school before, but more pharmacology, pharmacy, drug discovery, medical device development, help new engineers how to develop a new device and work on new things. Very much on the delivery systems of the medicine and how the medicine gets absorbed by the patient, which is very good aspect and big aspect of pharmacology. That will actually good segue to introduce pharmacology. Pharmacology is the science that deal with the study of the drugs and the interaction of the living systems. So the drug does something to the body, and the body does something for the drugs. And I am, before I go in detail on the medicine and the pharmacology, if you allow me, which is not part of the university PowerPoint presentation, which is actually I'm using their PowerPoint presentation, is something we call the PPE, personal protection equipment. With COVID-19 available, it's very important for all as in the medical field, and also educate other people who we know on the personal protection equipment. For me, an example, I'm wearing my lab coat and I'm wearing my mask, and also I do have glasses and I do have gloves, and I do have all this protection is to protect myself, not to give the patient something they're already sick as is, and also not to to bring something from the patient and take it to my staff, to my community, and to my family. So excuse me. So it's nice always to be protected. uh, Really, if you are sick, you cannot do your job. If you're going to become sick with the patient, then the patient will not going to gain nothing from you. You're going to just transmitted the disease from one person to another person. So protection is very important. And also protect yourself. For example, you have to wear the right gloves and proper made gloves, because sometimes we handle the medicine to the patient, and that's where pharmacology comes. What the body does to the drugs and what the drugs does to the body, that's all part of the pharmacology. So I have seen and witnessed people take their fingers and touch the creams and rub it on under the wound of the person, and assuming that their body didn't observe anything from the cream, and assuming that they just helping the patient. It does not work that way. So you have to be protective. You have to work with always with your patient to make sure they are. I'm trying to just make sure that I'm getting the right pictures on the presentation. So I'm trying to video it in a nice way so the student can benefit out of it. So this is actually a picture of how to use the PPEs. So let's go to pharmacology. Pharmacology is, as I said earlier, is a science that deal with the study of the drugs and the interaction of it and the living system. Also, the word pharmacology, based on your presentation here, it comes from the Greek word uh, and pharmaco and ecology is a word of the science. Uh, the word pharmacology is driven as it's said is initially from the Greeks, but the Latin as well, and it's all about the drugs and the drug substance and the use, what is used for. Sometimes we use the drugs for diagnose. There's some medicine is made or some drugs is made to diagnose a disease or a stage of the disease, and also it can be used to prevent from a disease, and also to treat a disease. So we make the drugs for many things. So an example, prevent people from having AIDS. So we're making the drugs to make sure that people will not, if they're exposed to the virus, they will not carry it or have it. And there is many substance and many programs is ongoing now to help us to they use to diagnose, cure, and prevent. So since I have tools in front of me, so this is an implant applicator. So many of you have probably seen it. So you can put a rod underneath the skin of the patient, and it will stay there, and that rod will help to prevent. And there is something called, for example, for somebody who have asthma, so you can give them an inhaler that will treat. And you have another asthma, it also, you can just take it as a dry powder inhaler, or this one a dry powder inhaler. So any of these can help you to maintenance or prevent, or not prevent, more like a treatment of the medicine. You have the breast controls, it prevent from treatment from pregnancy. So this is a treatment regimen for pregnancy. Then you have the insulin. It's insulin pen is used to also treat for for people who have diabetics, and also to give them maintenance. And there is a mitigation, you have, for example, if somebody just has a stroke, or say better maybe have heart attacks. So you have a loading dose and maintenance dose. So you have a dose you give it to the patient right away. It goes to the bloodstreams, and that will help them to, if you will, it's to open the veins and get the heartbeat close to normal, so you can save life. So pharmacology is many ways to do it, and it's actually regulated by government bodies. So some countries are regulated by their health department, and some of them, like in the U.S., the Food and Drug Administration is the one who regulate, is the agent who's make a regulation on how to make the medicine, how to test the medicine, and how to release it and approve it to the patient. So it's very very controlled environment. Also, you have in China, you have the Chinese FDA, you have in Japan, you have Japanese FDA, and also you have the World Health Organization, you have the EMA in Europe. All of them together, they work on to give to save the to make sure the patient get the right dose, and actually is managed. And because if you look at the historical information on the why the FDA was created. The FDA was created many years is because people were cheating on the medicine, and they're giving the wrong medicine to the patient, and a lot of infants died, and a lot of people died because they're not getting the proper treatment. So, and the agency have protocols and regulation how to manage and control all these stages of the drugs, and how to get released. So just following the presentation here, it said an example. Let me just go back. So just give me a second. I'm trying to get back to the slide. Okay. So side effects. The side effects is how the product get the toxic information, and everything we do in life has a side effects. Even if you drink too much water, you might maintain all the microorganism living in the water to your body and give you side effects. Drinking the soda give you side effects. You might have sugar rush, and you might feel like you're too hyper because it's loaded with sugars. And also the side effects of the medicine is how much toxic is the medicine. So therefore is the way is side effects is controlled by the FDA language. There's phases of development of the drugs. So they have the preclinical phase, they have the clinical phase, and with clinical phase also different phases. You have phase 1, phase 2B, and phase 3. Then you have the release of the products. For some of you might know that it takes about 15 years to develop a medicine. That's a long time to develop medicine. So a scientist, some of them, they only live 1 or 2 drugs developed in their lifetime, because otherwise, if they started at age of 25 and they need 15 years to develop the first one, another second one 15 years, they're ready for retirement. So they take the development of the drugs is very serious and very important, because toxicology is deal with the adverse effect or the adverse event as well of the drug, and also a study of the poison detection of the drug. So that's why when many of you knows that when you go to the doctors before they describe a new medicine to you, they do blood work. They want to show the elevation of the liver enzymes in your liver, so to see if you're already elevated, and if that medicine is going to be proper medicine for you and is going to help you. So drug toxicology is important. Then drug allergy is also very important. So you have many people is allergic to something. So an example in general, some people, when they have too much salt, they have allergic in their mouth. They can feel it because too much salt. Sometimes people, which is common probably, and you have seen it, people allergic to penicillin. So you, as a nurse, you have to know or read the chart of the patient to make sure that they are not really, you're not giving them medicine is going to harm them. And also, drug allergy is very important. It's because it's we don't want to bring a new serious effect or a reaction to a patient if it's not needed. So some people, you heard about people dying because overdose. You give them too much, you inject them too much, then they're gonna die, because the body cannot take the toxic. It can just take over. Some of them is like they're allergic to penicillin, and you give them from any of the penicillin family, so amoxicillin, ampicillin, dioxicillin, they could have toxic reaction to it. That's why it's done during the preclinical studies, and you know, and also medicine to medicine interaction together. So if you give this medicine and this medicine, maybe together they give that person a diarrhea, they give that person headaches. So if you are always looking at the fine tones of the device or the products, you're always going to see that might not, you might need to take it with medicine, with water, you might need to take it with after food, with food, without food. Is also prescribed. And also it could tell you that if you are pregnant, do not take it. If you are high blood pressures, do not take it. If you have if you're diabetic, do not take it. So they do all this part of the labeling on the product. So please make sure that you always document what the patient telling you and translate that to the doctors, because the doctor could help them to prescribe the right medication for them. And we as a nurse and doctors, we are responsible to educate our people and also tell them, you know, one of the things I like to do, and I always teach my students, is always have a safety moment. You know, we gather with friends, we gather with families, we gather with colleagues, we gather with community. Was part of the pharmacology. In order for you to observe it and learn it really good, have that safety moment. So pick up topics and tell them a story about it. For example, I can give you a story about COVID-19. I will tell my friend, if we all wearing a mask, if I'm wearing a mask and you wearing a mask, the contamination between us is almost close to zero. If I'm wearing a mask and you are not wearing a mask, I'm gonna transmit something from me to you. The chance that you're gonna get COVID-19, it's higher than zero. Could be 30%, 40%, because it might come to this surface and you touch it in your hand, and later on touch your nose, you might get it. If we're both not wearing it, the chance that we're gonna get it, if somebody has it, we're gonna get it. So we'll get it. So this is part of the safety. So try to have a safe moment. And also, one of the things you can talk to your people, to your friends and your colleagues, is another topics is using the pharmacology. Talking about allergy, pick up something and I said, you know, I had a patient today and I give them amoxicillin. Then after that, I give them a painkiller. Then they couldn't go to the bathroom for 2 days. So this is pharmacology now. Why they couldn't go to the bathroom for 2 days? Let's analyze this. So get your friends, your colleagues to talk to you, and you talk to them, because the painkiller or anything that has codeine, it could make you nauseous, it could make you upset stomach, it could make you constipated, and it varies from one patient to other patient. So use that road of knowledge or bank of knowledge to share it as a moment every morning when you meet with your colleague or your students. If the class has 30 students and each one comes with a story every day, believe it or not, you're gonna know pharmacology back to back. So if you're talking about anti-Angus and Angus, and a person can give a story behind it, and gonna talk about what really, how the drug is being used, and how the drugs has been reacting to the body, and how the body reacting to the drugs, and how the substance affecting us. That actually will help them to understand, and how it vary between one person to one person, from one drug to another drug, from one dose to another dose. I think we all can learn from each other faster than just this is frozen me. Okay. And here are more definitions in here. It's the tolerance. So each body depends on the weight, depends on the how much dose of a given them, and how depends on the drug and how long, and depends on actually the formulation of the drugs. Some of them is time release, some is not time release, and how much consumed, and what therapy is using, and the route of the administration. All this, the body can have tolerance to it. So, for example, something comes in a tablet, is widely used. You know, when it goes to the GI systems, it has big real estate space and different pH in the GI system. The drugs can be absorbed in different area. Then you have an example for this one. If you inject somebody's sub-Q under the surface of the skin versus you injecting somebody in IM, intradermal, which is longer needles. So how long this needle? So when you inject that person, it goes right away to the blood flow, and it goes faster. So everybody has different tolerance. So for most of the vaccine, as you know, it goes into muscular, and for insulin it goes sub-Q, and for example for the implant, it's under the surface of the skin. It works, and there is something in nasal spray. So the route is very important. So then you have the mouth inhaler, then you have the other mouth inhalers, then you have the Band-Aid, intradermals, and you have the creams you put. So everybody has different tolerance to how the drug products. And for people on oncology, which they have to give them really harsh drugs for them to be able to not feel pain. Also, they have a lot of tolerance on that. So we have following the prescription of the doctor is really important and key for success. And also the addiction. They have here the slide on addiction. So there are many different drugs which may use to treat single disease. From these drugs, always present a drug of choice is not available to the other. So yeah, we can substitute drugs, and we can whatever available we have to work with. But for me, living in America, I think all the drugs are available. So maybe this is more affect other regions of the world, but there is, if you look at the drugs and the medication, every day there's a new approvals. So every day a new medicine coming, and the doctors, depends on the doctors, they are up to date or not. They might prescribe old medicine or a new medicine. Normally the new medicine is proving to be better than the old medicine, and proving to be more safe than the old medicine. Otherwise, who is going to market it, and who's going to spend so much money if it's not treating something really important? They always look for a benefit in the new drugs than the old drugs. Pharmacopoeia. The definition of pharmacopoeia. Actually, I do have a book somewhere here on pharmacopoeia. So it's a big book, a huge book, which is it show you all the formulation, all the medicine, and what's being prepared. There is one also for EMA has one, and also the Japanese pharmacopoeia has one, Chinese pharmacopoeia has one, and also there is a regulation which is called USP. Like if you look at the some of the stuff, if you go on the shelf and it said test it as per USP, and you found this common language normally are in the vitamins. USP is United States of Pharmacopoeia, is actually is like a Bible, is like a book, is rules how to test. If you test it through against this protocol and against this step by steps, that will make it is more FDA approved or USP. Sometime when there is not FDA approved, they use USP tested. So just you know, to comfort the people, and they use it as a marketing gimmicks more, because if, USP approved does not mean is FDA USP testing does not mean approved by the FDA. The approved by the FDA only when the FDA really rubber stamp it and approved it. For more on the slide next is name of the drug. So you have the chemical name, generic name, and the trade name or the brand name. So for example, I'm using this one. You have Derola, and it's memetazone fluorate, and probably in every country has different names, and the chemical name, it's not really, it does not change, but it's not used widely. Generic names is mostly that what we use the most, and the trade name. So I would like to and different class is just to give you a chapter just on what medicine and drugs you'll be using daily if you work in for the intensive care unit, so you can familiar with it, you understand it, and you have the 30 second thinking about it. It's like, okay, I know that medicine, I know what this medicine for. And also the medicine is designed by the ending, the way it's ending, the way how you write the medicine. So you have the oncology medicine chapter, you have all the MOBs, you have the all, and I think I'll go slide by slide on that for the future. Okay, the branches of pharmacology. So you have the clinical pharmacology, so you have the formal orthopedics, so you have the therapy area. So you have very much we as you know, the therapeutical deal with the drug, the use of the drug, and prevention and the treatment of the disease. You have the pharma. So I'm not sure if this is the right time to stop and continue for different class, but maybe I can do the definitions, then I can talk more about it. So pharmacodynamic is the study of the effect of the drugs on the body and their mechanism of action. So what the drug does to the body. And this is very, very, very important slide. And also you have I just trying to get the slide to the right levels. So you have the pharmacodynamics, the pharmacokinetics, and you have the therapeutic area, and you have the toxicology. They're all very important, and you have the chemotherapy, and you have the definition of pharmacy. So the pharmacokinetics is the study of how the body absorbs the medicine, distribute it, then the metabolism, how you metabolize it, then how let it out, how it exit. This is very important slide. I can talk for days on the pharmacokinetics, and also it's very important for us to understand how the body works, and that also the pharmacokinetics, it decided the route of administration. Is it a tablet? Is it syringe? Is it a cream? Is it through the eye? Is it through the nose? It's very important slide, and I'm just trying to see if this is the right time to stop and continue for different. Um, yeah, I would like to stop here because the pharmacokinetics is really a big slide and big talk. So I want to thank you for listening to me. I my experience, normally I don't talk to my computers. More I talk to the students. So I tried, and also I did not read the slide in advance. I'm just doing it as I'm talking to you, and this is a good introduction just for me to know you and you guys to know me, and uh, and also I will share my email so you can ask me direct questions. This is the best way, and from now on up, if you whatever student, how many you are, try to do the whatever the lecture was is to do the a minute, but when you meet another student or before another class, pick a topic and just each one to say something about it that will stay in your mind forever. For example, the for pharmacokinetics, the slide I'm showing now, the absorption. It is the process that cure from time the drug entered the body to the time it reached to the blood streams. What does that mean? So if each one says something, you will remember it the rest of your life. With that, I want to thank you and have a good day.